Its purpose was and is to reach underserved populations, largely rural health. And so we're addressing primary care practices and teaching them how to take care of children with asthma, following the most current evidence-based guidelines. As this program evolved over time, we learned how to do this better and built this very intensive short version, which we call the boot camp. So the way this training works is the providers take a 90-minute course online before we ever get there. Then we come in and have one intensive day where we train them on how to manage asthma. We train them how to use a spirometer. With the grants that we get, we actually give them a spirometer to use and give them intensive training in not just administering, but then interpreting the results from the spirometry. And then, after we're done that day, we step back, but we come back a month later for a booster, a refresher, to review critical information, to answer questions, to practice spirometry. And that combination of going out into the community, coming back for a booster, and then remaining available to answer questions. We can have follow-up webinars depending on what the practice wants. Adapting to the practice has made a big difference. We found that the practices that have received the training was using the elements of the guidelines, particularly spirometry and asthma action plans, and following those guidelines closely compared to the other matched control practices. And outcomes included a significant reduction, a 35% reduction in hospitalization rates in the children who are in the practices that we trained. Very few asthma studies have been conducted in rural areas, and yet that population of patients often has very bad asthma at the same rates or greater than we see in cities, and they often aren't getting the kind of care they need in order to be well managed and under good control. So it's an area that's been under-addressed that really requires, and it's about time they've gotten the attention from the National Institutes of Health. This is a model that could be adapted to any chronic healthcare condition. If you take the big ones, asthma, chronic obstructive pulmonary disease, diabetes, cardiovascular disease, this could be fitted to any of those as a way to help bring primary care providers up to speed and keep them there. So the Navajo Nation is the largest tribal population and the largest physical reservation in the United States, 27,000 square miles. Their asthma rates among children are double that the rest of the United States. So we've received another grant from the National Heart, Lung, and Blood Institute, and over a period of 7 years, we're working with that population, building asthma programs in 3 different communities on the Navajo Nation. So this has been my favorite project, my high water mark of all the work I've done in the last 4 decades. It's the most rewarding because you see a need that's so clear and dire, and moving in and trying to help with that need is greatly satisfying.